Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to the final segment of Healthcare Consumerism Radio. We always save the best for last. We have it joining us today from Littler Mendelsohn, which is the largest law firm in the country helping employers deal with labor, employment, and benefit issues. We have Stephen Friedman, who is co-chair of their benefit practice. Stephen, good morning to you.
Good morning.
Hey, I appreciate you being on the program today. I know kind of one of your clear objectives is really helping the small employers, small businesses understand kind of the impact of Obamacare and what we want to talk about this morning. Define for me in your terms, because it's all over the lot, what you define as a small business.
Well, generally $20 million or less of sales.
Okay. So that can be employee size. That could be a company that could be up to 250 employees or so.
Oh, sure.
Yeah. So what do you see, we just got a notice here a minute ago that the House, voted to fund the government but defund Obamacare, but we all know that the Senate's the key there. So there's a lot of moving parts over there that could impact kind of this discussion. But I think it's important that businesses keep their focus on where Obamacare is. What do you see as some of the big concerns for small businesses?
Well, it's interesting. It's always hard to tell from anecdotal discussions with clients or other folks you run into as to what the business community thinks about something like Obamacare. So what we did was we actually had asked the Gallup organization to do some polling for us to find out what small businesses thought about Obamacare, looking at that $20 million number as the threshold. And interestingly, 48% of those polled thought that this would be bad for business. Only 9% thought it would be good for business, and 39% thought it wouldn't have any impact on their business. And that was really a shocking statement because of the huge number of folks that really thought this would be bad for their business, and a very, very low number thinking that this was good news. Mm-hmm. We also asked about...
I think it's also interesting, you're a high number of businesses that really, what it would appear to tell me, they really haven't paid attention to what Obamacare could do to their business. The number you're saying really don't have any idea. They maybe haven't stopped and really looked at it yet.
That's right. Yeah. That's right. And this was before the employer mandate was delayed until 2015, but still we're finding that folks aren't focusing enough or enough attention on everything that needs to be done before the employer mandate takes hold. We also asked folks if they thought that this would cost more money or have really very little impact on the amount that they'd be paying in to health care, and 55% of the employers thought that this would raise the amount of money that they'd be paying in, but only 5% thinking that this would lower their costs. So that was telling as well.
I mean, there's just so many unknowns. I had an interesting discussion the other day with an employer with almost 450 employees, Stephen, and they made a decision to exit the healthcare benefit business for one distinctive reason, because they sat around the table, the CEO, CFO, and the team said, we don't know who's on first. We don't know what to project. We don't know how to predict the impact to our business. So we're just going to, not do it. And we're going to, pay the penalty.
And that's consistent with our polling results as well. 53% of businesses told us that they were considering dropping health care, which is a huge number.
Yeah.
Even more shocking is the percentage of employees that reported they reduced the number of hours of employees to part-time status, which was 18%. That's the number that reported that they already reduced the number of hours to part-time status in basically ahead of what they thought was the 1/14 effective date.
Now, Stephen, what are you seeing a lot of these small employers doing to kind of blunt the impact of Obamacare?
Well, there's a lot of folks who are calling us who are asking, how do we restructure our business? how do we move employers from benefits eligible to benefits ineligible status? And frankly, that can be very perilous from a legal perspective, because there's been a lot of laws passed which restrict an employer's ability to take someone who's benefits eligible and make them ineligible for benefits just to save money on health care costs. So it's something that we're dealing with employers every day on, basically workplace restructuring without triggering any laws. You can also, or rather any legal problems. You can also have a problem if you decide to move people off of health care and it's discovered that they're either older than the mean employee, or if they're folks who are disabled, or if folks could say that they were moved because of other discriminatory factors such as gender or race or something of that sort. So employers have to be very careful in what they do, but they're all moving in the same direction, and that is to try to get people from being eligible for benefits to part-time status or other ineligible classifications.
Isn't it very interesting, Stephen, that Obamacare was focused on making sure more people were covered, their health benefits were covered, and what it's really doing is driving employers to uncover employees, not really because they want to, because they responsibly need to, because they have fiscal responsibility to their organization, that they can't deal with the regulations and the cost around it.
You're absolutely right. We have put together a list of all of the unintended consequences of Obamacare that seem to be coming to the fore, and certainly slowing down the trajectory of small businesses wouldn't have been anything that anyone would have guessed would have come about a healthcare reform initiative. But that's unfortunately right where we're going with this.
What's your advice to your small business clients around defined contribution and exchanges, public and private?
With respect to the exchanges, I think we're all in a wait-and-see mode right now. I think it makes sense for small businesses that are eligible to look at exchange coverages to do so come October 1, and businesses with under 50 employees may be able to do this. But we don't know if these exchanges are going to be any good for anyone, including small businesses, because of the very real possibility that the exchanges could be filled with folks who are older and sicker than the general population. So it makes sense to take a look at the public exchange and see who's in there and see what the costs are. But it is by no means something that is going to be necessarily a good place to have your health care provided. The private exchanges could be a good deal, and those are, I think, certainly entities that should be looked at as well. They may have better statistics and healthier and younger people in them than the public exchanges. So I think they're worth taking a look at. But
there are challenges with the private exchanges and the defined contribution, funding instrument, particularly when it's attached to an individual plan. Correct? I mean,
that's right.
I mean, they can't use an HRA, right? They can't do that.
That's right. Well, yeah, HRAs are going to be very difficult to utilize, and I think you've got to be very careful about making sure that you're going to the appropriate folks for advice. Whether it's a consultant, an attorney, whoever is knowledgeable about these vehicles, because there's clearly a lot of complexity involved, especially as we move into 2014. And then even more complexity as we move into 2015 with respect to all these different types of healthcare vehicles for different types of employers.
Stephen, when you talk to your employer clients, is there a specific thing that they say about this law that if something were to be rewritten inside of the law, it would help them out greatly? Or is it one of those things where they say just get rid of the whole thing?
Well, some of the things that they say I can't say on the radio, but basically there is a lot of fear out there. I mean, it's just a fear of how much are the costs going to rise in 2014? Mm-hmm. How much are they then going to rise in 2015 when the employer mandate takes hold? And is there any way to avoid some of these crushing costs that haven't been seen before, where there's going to be more people who have to be covered? How is that going to not only affect their business, but how is that going to affect the costs of goods and services that are being provided by other small businesses and other businesses that have had their costs increase? I think there's just an awful lot of concern out there for those reasons.
Stephen, we've got about 30 seconds left on the program. What's the one big takeaway that you would leave our audience with regarding the law?
Well, focus on the law. Focus on your alternatives. Look at both changing your plans, restructuring your workforce, doing what you might need to do to stay competitive, and making sure that you take these actions with a trusted advisor who can help you with the legal maze and the other types of complexities that are at hand here.
Stephen, thank you very much for joining us today on the program. Have a great weekend. To the rest of our audience, we will talk to you next Friday.